The good thing about these intensive types of treatment is that they really have a strong impact. So we can look at cognitive development measured with IQ here, and we can see that at the beginning, right, and at the end for the treatment group, TX, there's a big difference from a beginning point of an IQ of 60, so in the mild range of mental retardation, to a group mean above 80, so in the low average range. And when you see a mean like this, or like that, you have to imagine a line going from about 65 up to about 105, describing where 70% of the sample is. So when we say a mean of 82, some kids are above that and some kids are below. Now what happens over here in the comparison group is they start roughly at the same level, but they actually show an increase, but only up to about 70. So their mean is still right at the cutoff for intellectual and developmental disability. And what ends up happening is we see that in this kind of randomized control trial of ABA, we tend to see an increase of about 12 IQ points. Now, this is the second of these studies. And we now have 3 studies, or 4. You know, Sally Rogers has developed the Early Start Denver model, which has both a behavioral component like this and then also a child-focused approach and is more efficient, fewer hours. That shows the same effect. So we're getting to the point where we can begin to say that these early intensive interventions tend to decrease the likelihood that children with autism are also going to be affected by intellectual and developmental disabilities. That's a really good thing. We don't know if that's connected to the increasing proportion of children in the population with average IQs, but we do know that we're on the cusp of being able to say these have an effect on the cognitive disability that goes along with autism. We don't know if it really reduces autism per se. So that's basically what I said in that slide. I don't mean to rush that through, but so let's now go to this targeted pivotal approach. And Connie Cassary, Dr. Cassary's talked here, so you may know this better than I, but you might not have had it juxtaposed with an ABA approach, and it might not have been clear to you what Connie was doing. What Connie's doing is taking children who are in applied behavior analysis treatment programs, right, where they're getting 30 hours a week of ABA, and then she's adding 30 minutes a day for 5 to 6 weeks of training that she thinks is going to affect initiating joint attention. So she's adding a very small addition for a constrained period of time to try to boost the impact of ABA, okay? And what she finds is that, first of all, using either intervention that's absolutely focused on initiating joint attention or using toy play where you're trying to get the child to engage in symbolic acts, either one of those boosts the tendency of this behavior to look back and forth with a tester spontaneously, to spontaneously share experience with other people. And what she sees over time at a 12-month follow-up is that the kids in ABA and getting joint attention or symbolic play intervention show more of these behaviors than kids in the ABA alone. And in fact, there's a little bit of a decline in the ABA kids, and it's not clear whether that's, we should even take note of that. We're not sure there's really a decline there. Now what happens? Well, this is the more important thing. So when you look at language follow-up 1 year later, you can see the kids that were in the joint attention intervention programs, or the intervention programs that improve joint attention, do better than the other children just in ABA in expressive language. So it acted as a booster in this study. What's also critical is that initiating joint attention improvement was the best predictor of 4-year outcome. So by taking theory on joint attention, understanding its relationships to social learning, saying that it's a symptom that's contributing to the impoverishment of learning opportunities, and then targeting the symptom, Connie has reported an intervention that looks like it can boost a more extensive or comprehensive intervention and actually increase the power of early intervention. Now, there's a couple things. This is not the only study that's found this. Jones and Carr, and Whalen and Schreibman, and you probably all know Laura, or have at least heard of her, have also reported what's called a cascading effect. You change joint attention, and you end up having an impact broader than the intervention itself. It has an impact on learning in general. We also know there's an interesting study by Mike Bono and Marion Sigmund where they were looking at children in a community intervention for language, and they looked at it for 1 year, and they didn't see much of an impact, and they're thinking, there's got to be an impact. These kids have been in a language intervention for a year. So then they went back and looked at responding to joint attention and initiating joint attention, and in that study, if the children had developed responding to joint attention, they not only showed a response to the language intervention, they showed a dose response to the language intervention. More language intervention, more improvement if the child could follow the gaze of other people. If the child couldn't follow the gaze of other people, no impact of any intensity of language intervention. So together, we're beginning to see that these joint attention skills are a useful target, and they're probably a mediator of the capacity of a child to respond optimally in early intervention. The good news here is this isn't limited to a tester doing this. Marion did a great study, and Mike Siller, who's now at Hunter College in New York, in which they found that did parents follow the attention of their infants with autism or their young children with autism? Because we know following the gaze of a child is a better way to provide information that the child's likely to take in rather than trying to direct them. You know, so if you're trying to teach a young child, you don't say, hey, look over here, let's think about the train, if they're over here working with the toy fruit, right? You go to the toy fruit and you say, oh, that's toy fruit. That's something that looks like something that we would eat, but we'd never eat that because that's a toy. It's not real. And you'd work on what they're looking at, right? Well, what Marion found was that, yes, in fact, there was no difference. Parents of children with autism do this as much as parents of typical kids. But the individual differences in the parents of autism were related to language gains. It's also true that it's related to language gains with the typical kids. But it suggests that what we do in the home can be changed. So we start following the gaze of children and engaging in joint attention with children, we might be able to have a slightly better impact on the children over time. Okay, so I've got 5 minutes. In 5 minutes, I'm going to tell you what's happening in terms of school-related research, right? And it's easy to do this in 5 minutes because, unfortunately, we're not as sophisticated in what we're doing with kids in schools. You know, science takes a while. I wouldn't say we know exactly what to do in the preschool level, but we're much better informed than we were 10 and 20 years ago. And now we need to translate that. We need to make that happen with school-age children. So, you know, if 59% or 50% of kids with autism are what we call higher functioning autism, because we don't use Asperger's disorder anymore, it's interesting to know that at least half of those kids underachieve academically. Even though they're capable and competent on the cognitive level, they're still underachieving. And we didn't know this until just recently. Everybody assumed that they were doing just fine. That's not quite right. People had the hope that they were doing just fine academically, but they're not. They have a real struggle, and particularly in the middle school and high school period. Poor reading comprehension. Poor reading comprehension is really one of the cusps: written expression, abstract math, and inferential skills. And outcomes vary from being, 30% doing pretty well to less than 30% doing pretty well. And these are people with the intellectual capacity, the cognitive capacity to do moderately well. So we're not doing enough in the school-age period. We know it, and it takes a while to get there. And here's a great review of the research on academic performance for school-age children with autism who are higher functioning. There's been a lot of studies, but only 118 children in all those studies. So they're really all case reports. We don't really have a clear evidence base for what we should be doing to help kids learn in school yet. We just don't have it. We will, but we don't have it yet. The other complication is that, many children who are higher functioning, probably many children with autism, can also exhibit the symptoms of ADHD. Now, they're different, okay? The joint attention disturbance is different than an ADHD disturbance. And there's even some suggestion that the kids with both have some of the genes that are risk genes for ADHD. So we think that it's an overlay, not necessarily completely part of the syndrome. But that's really important because ADHD can really undermine even the fragile capacity to learn well in the classroom for a child with autism. So what we're trying to do is we're trying to use virtual reality. One of the big problems here is, when we measure social attention or joint attention in infants, it's one-on-one. What can you do with one person? Throw a child in a classroom and it's no longer one-on-one. It's one-on-many. The child has to be able to distribute their attention across many people. Much more complicated. Very hard to measure, very costly to measure. So one of the things that we try to do is we try to use virtual reality where a child's wearing a headset and then they're actually placed in a classroom where this is a child looking around in a classroom and they can see a lot of different avatars. And we can ask them to look at the avatars, and we can make it more or less interesting. We can say, if you don't look at the avatar, they're going to start to fade, and then you have to look at them in order to make them become solid again. Okay, so that's one of the basic paradigms we have now. So in this paradigm, what we can do is we can ask children to do something that is a normal part of social attention development. We want you to talk to everybody in this room and look at everybody in the room while you're talking, just like I'm having to remember right now. You people over here, I keep forgetting about you. I keep forgetting to look at you, right? And it's hard. It's hard to remember to look at everybody in a room. But as we grow and develop, we really develop the capacity to distribute our attention while we're expressing our own ideas. We've never measured that in kids with autism before, but that's an adolescent step in social attention development. And what we find is this, is basically, and I'm going to stop with this slide, but this is pretty important, is that basically we have two age groups of kids. We've got high-functioning children with autism in age and IQ matched controls. We've got younger children, 8 to 11 years old, and we've got older children, 12 to 16 years old. And we put them in that situation, and we say, we want you to look at all the avatars while answering questions. And, it's hard. I've tried to do it. It's not the easiest thing in the world. And so what we find is that for young children, there's no difference between the 8 and 11-year-olds without autism and the 8 and 11-year-olds with autism. No difference. They do it, not very well together, right? The older kids in the typical group show this incredible increase. I mean, just a huge, huge increase between pre-adolescence and adolescence. They get much better. And there's a lot of reasons for it, one of which is that their brains are developing in a way that lets them do this. Unfortunately, the kids with autism don't show that developmental leap at all. So now we're beginning to suspect that there's and we've known this for years, sort of clinically, that middle school to adolescent transition for kids with autism, things start to happen and they start to fall behind more. And we have to understand why that is. We think we've identified something. And the good news here is, if we use fading targets, that difference disappears. If we cue the kids, that difference disappears. It's only when they have to spontaneously organize it. So we think since we can use an external cueing device to increase this, if we get kids to practice this a lot, we have the beginnings of a way to address what looks to be another later developing expression of social attention disturbance in kids with autism. Thanks very much.